Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. We're seen on WYW19.com and UVerse Channel 19. I'm here with Dr. Anthony Tony Pannozzo. Tony, you mentioned 65,000 patients. When did you start treating patients?
1968.
Okay. And was your practice, has it changed over the years? Have modalities changed?
Well, we've become better at it.
Okay.
We had a large learning curve there.
Right.
So now we have it pretty much under control. But it's a new field. There aren't many people do what I do. My son does because I trained him. But it's a unique approach to the pain problems that we have. No drugs are used ever. None are prescribed. We use
Well,
shots.
you're injecting some.
We inject, but that's it. It's a short-term, short-acting steroid.
Okay.
And so it's out of the body in a day. That's not what's doing it. It's how you do it, where you do it, why you do it.
So you find an issue. You find a target for your injection.
Exactly right. Yeah.
And from what you're telling me, you inject them with a substance that's out of the body in 24 hours.
Yes.
So
Sooner than that.
So how does it work?
It just takes inflammation out of the area. So the source of pain is usually a ligament, which has been traumatized.
Right.
What do ligaments do? They tighten down.
Okay.
So all these steroid does is release it, and there goes your pain, just like that.
Just like that.
Just like that.
That's kind of amazing.
Yeah.
So will people, I guess they lay down on a table or some type of examining table, and you localize it, you use special x-rays, you said?
We have a fluoroscope.
A fluoroscope, which will identify what you told me was scar tissue?
Well, it just shows bone.
Okay, it shows
So
bone.
you have to know what you're looking for. It's a guide. So in other words, if somebody is, say, a little bit heavy, you can't feel the bone structure.
Correct.
Well, at least you have a guide there. The fluoroscope with a marker will guide you to where you want to go.
Now, when you give the injections, because people are always concerned about injections, do you numb it for them, or do you need the sensation to let you know that you're at the right place?
Now, I think you stumbled on something because we need that feedback. So we try not to numb it. We try to get that feedback. It was at the right place, and they will know that.
I'm sure they will.
So I approach the pain problems as very personal. It's me and the patient, and we work together on that. It's not like sending somebody out for therapy or taking drugs to see in a month. It isn't like that at all.
So a patient will come to you, and on day one, you'll listen to them, you'll examine them, you'll talk with them. Do they get treated that day?
Absolutely, yeah. I have I'm going to put a sign on my wall. I don't have it up there yet. You are not allowed to leave the office with the same pain you walked in with.
And you're not going to have a different pain. You'll have less pain. Okay.
No, not that pain that you complained about.
Now, you talk about this medication being gone from the body within 24 hours.
Yes.
Are there times that it needs to be repeated?
We hardly ever need to repeat a shot to a structure, one structure, and they're all listed where we've been. Of course.
When you do your diagnosis, this is fascinating to me, when you do your diagnosis, can you identify more than one area of problem?
Yes, absolutely.
Do you treat more than one area at a time, or do you treat one area at a time?
Well, it depends on the patient and how much they want done that day. The medication is not an issue. You can't be allergic to it, and it only causes blood sugar to rise, but temporarily. So it really is quite good. That's not an issue. It depends on, I don't know all the answers the first day. So we know the answer, what you came in with. Right. That one we can take care of. So subsequent days, the spine will adjust and you will get different symptoms. Now, what you do with those depends on how severe they are. So it's a personal thing, like the patient and me. We discuss what can be done and what their wishes are, and that's how we do it.
When somebody comes in to talk to you, do you say to them, I can guarantee you're going to walk out of here with less pain than you walked in with?
Well, almost. Not quite.
Now, I happen to be amazed at how quickly the steroid injection works for what you're describing, because I would think that that takes time for the anti-inflammatory aspects of it to work, but from what you're telling us, it's
no,
almost...
No, it's 2-3 minutes, that's all.
Really? Amazing.
Yeah, amazing, yes.
Do you, is all your target area, is it from the head down to the bottom of the spine? Where is it?
Any part of the
Any part
of the body, actually.
Okay.
Actually,
All right.
we just worked on migraines, so we could take out any migraine. Now, you realize when you're talking about migraine, you're talking about air. There is no, you can't treat anything, can you, without having a basic structure to do it to?
Okay, we're going to get back to migraines in just a moment. We have to take a break. It's Dr. Kenny Levine with Health Talk, WEYW19.com, UVerse Channel 19. We'll see you in a minute. Thank you.